Hi, all. Thank you so much for joining us today amidst another very busy week. We're delighted to have everyone with us for our capital conversation today that really is going to focus on our new messaging. For those who may be joining for the first time, I am Sue Polis, and I oversee the public relations and government affairs efforts for Lutheran Services in America. I was just with Lutheran Social Services of Illinois yesterday, so apologize. We have a packed agenda. We're going to first start with just an update on House action this week related to Medicaid. Then we're going to move into our Medicaid messaging rollout, and we are joined by Silvia Manrique from 4Media, who's going to walk us through it. And then finally, Margaret Nimmo from Encircle will share insights related to their recent site visit with Representative Griffith, a member of the House Energy and Commerce Committee that they've been working to strengthen a relationship with, and also doing some great work to demonstrate the impact of cuts to Medicaid. So let's dive in. Next slide. As many of you know, there's been a lot of activity in the House this week with three committees marking up bills in order to meet targets for spending cuts to pay for the expiring Tax Cuts and Jobs Act, including significant cuts to Medicaid and SNAP, with SNAP cuts putting more pressure on state budgets, which will ultimately put additional strain on available state dollars for Medicaid. So a lot happening. Congress is now moving through the budget reconciliation process, a streamlined process meant to move legislation in an expedited fashion as it only requires a small majority of votes to pass. So we learned last week, of course, that Senate leadership has moved the marker from their more modest budget resolution to signaling a target of $600 billion in cuts to Medicaid alone. So this is really just a reminder, right, about the state of play. And of course, this week we saw, next slide. Of course, this week we saw a lot of action again in the House. Passing the House Energy and Commerce Committee passing their initial budget, which included $715 billion in cuts to Medicaid. So tomorrow we are watching the budget hearing in the House Appropriations Committee on all things Health and Human Service related measures. Then with the House GOP leaders moving the bill to the Rules Committee the next week with the goal of passing a final package in the House by Memorial Day. Now the action shifts from our narrow focus on the House Energy and Commerce Committee to a broader focus of members of the House of Representatives more broadly, with a continuing focus on moderate Republicans. Because remember, right, this is a very slim Republican majority in the House, and so our best bet is really to try to continue to move moderate Republicans to vote no related to this significant package of cuts to Medicaid, but also SNAP and its impact on Medicaid. So, the resources that we're going to share today you're going to have a lot of chance to put them into early action and focused on the House of Representatives. So next slide, let's review the impact of cuts outlined this week. As I said, they come with a price tag of $715 billion over 10 years, with the nonpartisan Congressional Budget Office estimating more than 13.7 million more Americans will become uninsured by 2034. So while we won't review the totality of cuts in great detail today, so we can move forward with the messaging presentation, next slide. These cuts make it harder for people to enroll in Medicaid. That's the headline. Slowing eligibility, which of course we know lowers enrollment, along with efforts to lower enrollment outright. For example, we see the delay of implementation and enforcement of the HH final rule passed last year meant to streamline eligibility, along with more frequent eligibility determinations, which adds administrative paperwork, including for our members as employers. Next slide. So while the evidence is clear also that work requirements add red tape and bureaucracy without improving effectiveness or efficiency and ultimately lowering enrollment, we see plans to move forward with them, putting additional burdens on individuals and employers again related to process. So Our timing is perhaps good today as we roll out our new Medicaid messaging. Next slide, which of course aims to position Medicaid in the context of the Lutheran Services in America members through ensuring that we are working to both defend Medicaid from potential cuts while at the same time working to also strengthen Medicaid given the innovative efforts happening across our faith-based trusted community-centered network. With existing and ongoing shifts related to Medicaid, including to managed care, value-based payment, or alternative payment approaches, including to address not just healthcare, but to address broader health-related social needs of individuals and families. And the move now, of course, we're awaiting more guidance on Make America Healthy Again and seeing where the Department of Government Efficiency efforts continue to look like. We seek to understand to ensure the work of LSA members are positioned for continued success and leadership. So today I'm delighted to introduce our communications partner for media and Silvia Manrique, who's going to take us through the exciting work that we've been doing. Next slide. Associated with our new messaging to support Medicaid. So Silvia, let me turn it over to you and take it from here.
Great, thank you everybody for joining. I'm going to share my slides and walk you through what we've been working on. Bear with me one second. Can everyone see my slides? I will assume yes.
We can see it, Sylvia.
Okay, great. Great. So what have we been working on? That's what I'm going to walk you through today. I'm going to talk a little bit about the work that we've been doing, the key learnings from our media landscape and what we've been doing behind the scenes. Then I'll walk you through the unifying concept, which Sue just shared a little glimpse of. And then we'll look at that unifying concept, sort of walk you through how it came about, and then we'll show you the key message themes that are part of that, as well as the tools that will now be available to you. So what we've been up to, and I think, the headline here is that we've equipped our network to speak with one voice. That was really the impetus for taking on this work. We began by analyzing the media landscape, what's being said about Medicaid, who's saying it, and where our voice is missing. And when I say our, I mean Lutheran Services in America. And from that work, we developed a unifying concept to really help bring clarity and consistency to how we show up and what we say. We identified the message themes that matter the most right now, really grounded in the Lutheran Services in America remit and sort of what you're seeing on the ground every day. And then we created practical tools to really help amplify that message across a variety of channels. So the first step that we took on was the media landscape analysis. And as part of that foundational work, we conducted a media and social media landscape analysis where we examined a 1-year period of conversation around Medicaid and faith-based organizations and sort of the broader social safety net. And it wasn't just about volume or sentiment. We really analyzed how Medicaid is being framed in traditional media and online conversations, where misinformation and confusion tend to take hold, and where trust is strong. So we really identified sort of influential voices, both individuals and institutions that are shaping public perception around Medicaid. And what we found was really eye-opening. We saw clear patterns of narratives that were breaking through, which messages resonate across ideological lines, and where the conversation sort of gets lost in noise or misinformation. So these insights were really critical for us. It helped us to speak to what people are already believing or fearing, deliver messages that are clear and credible and grounded in real world dynamics. We didn't just want to guess as we developed the strategy. We wanted to really understand how we could shape the conversation to really move hearts, minds, and policy. So here's what we found. 5 major themes emerged as we, looked at these collective conversations that, here, if you'll look at the the graphic there, and it really represents sort of a comprehensive view of how religious and community-rooted organizations are perceived and discussed when it comes to addressing society's most pressing challenges. First, faith-based organizations are really widely seen as credible players in healthcare and social impact, especially where institutional trust has eroded. Second, there's a clear recognition of the role of community-rooted organizations in tackling everything from health and education to economic justice, and to public safety. Oftentimes, they're not just support systems, they're primary systems that people turn to. Third, we really saw increased public mobilization against the Medicaid cuts. So, and cuts to really public services, so especially healthcare. People are really paying attention, and they're engaged. Fourth, we saw faith-based groups being viewed as a moral counterbalance to sort of the very polarized, politicized narratives that surround Medicaid and the national discourse around Medicaid. So that we really identified that moral authority really matters. And finally, nonprofits are driving innovation and filling critical gaps in service delivery, particularly where government systems are under strain. So these findings really validate that important space that organizations like Lutheran Services in America already occupy and point to a really powerful opportunity to lead the public conversation with really clarity and conviction. So while we've been busy, Congress has also been busy, and Sue shared deeper look into this. But we know that the proposed cuts are there, and that harmful policies are really taking hold. We know that the proposals to cut billions from Medicaid are advancing. We know that work requirements are being promoted. We know that there's a lot of misinformation about fraud and waste. And we know that that there's also there's a push to roll back Medicaid expansion in key states. So that means that the stakes are higher than ever. And so, as we know, the Medicaid conversation is being had with or without us. And the cuts are being framed as fiscal responsibility. Faith-based voices are mostly missing from the debate. Headlines really focus on cost, not consequences. And oftentimes these decisions and policy interactions are moving faster than the public can really even make sense of. So public awareness, although people are engaged, I feel like, we found that people are not, it's moving so fast, people are not understanding really what the consequences are. So, at the same time, Lutheran Services in America is really in a unique position to defend Medicaid, just because, our members really walk the walk. They walk alongside people navigating illness, caregiving, disability, poverty. We really see the Lutheran Services in America members really see how Medicaid keeps families together and strengthens communities. And our network's position in defending Medicaid is really based in lived experience, right? You understand how Medicaid impacts communities and the people that you serve. So why do we need unified messaging? And this is really important because defending Medicaid requires a focused strategy, because we know that Medicaid is already, people already have beliefs about Medicaid, the beliefs that they hold, the misinformation that they've already heard. So why do we need unified messaging? And it's because clarity really combats confusion, consistency builds credibility, unity amplifies our impact, and the frontline experience that Lutheran Services in America has makes people really listen. So our opportunity is to reclaim that moral narrative, push back against false claims with truth, show the real impact of Medicaid, unite people around care and community, and lead with courage, clarity, and conviction. So now is the time to speak from that experience with one voice. So we're introducing the tagline, "Here we stand for people, for care, for Medicaid. So what is Here We Stand? Here We Stand is a unifying advocacy campaign that helps Lutheran Services in America and its members speak with one voice to protect Medicaid. It's a rallying cry that really helps anchor our messaging, which I'll share in the next few slides, with clear, consistent language that we can all use. So you'll see Here We Stand across all the tools that we've created to help you share stories, influence policy, and defend care in your community. So why Here We Stand? So I'm sure some of you may have already heard about Here We Stand. But in 1521, Martin Luther stood before power and declared, "Here I stand, I can do no other." And we really think that that moral clarity is really needed today. It's not about sparking division, but to defend what Medicaid does. It reclaims faith as a public good, not a political weapon. So it's rooted really in service and what Lutheran Services in America is all about. It's a message that resonates across faith, civic, and secular audiences because it's about values, right? It's about responsibility and about truth. And it also echoes a moment of courage from Lutheran history, which, we really need that courage today to defend Medicaid against these cuts. And then it also gives supporters, stakeholders, and communities language that they can stand behind. So it gives people something memorable, something repeatable, and something emotional beyond just facts and figures that are often the way that people defend Medicaid. So why do we need a unifying concept? And that's, again, harkening back to what I mentioned about, why we need this unifying messaging. It's really about speaking messages in simple, clear tones that can cut through the noise, cut through the politics. It also captures the spirit of our strategy in a way that people can feel, repeat, and rally behind. And because of the Lutheran essence, it distinguishes our voice from other Medicaid advocates. It really reminds listeners about what Lutheran Services in America does and where the POV is coming from, right? It's coming from actually serving people who use Medicaid. So how will we use this unifying concept? You're going to see it, and I'll share a lot more about that in the next few slides, but you'll see it in our advocacy materials. You'll see it in op-eds as a closing line. You'll see it on social media as a tagline or hashtag, and you can see it in leader remarks. We'll give you a few examples and some of the tools that we are sharing also today in the next coming slides. So now that I've shared the tagline, I want to share the next level, which is sharing why we stand for Medicaid. Now, there's the 6 core message pillars that will really share the meat of the information that we want to share. 6 pillars that share simple, strong messages and language that you can share anywhere with lawmakers, media, partners, neighbors. Really, anytime you have to speak about why Medicaid is important, these 6 message pillars will help. They're rooted in real impact, aligned with our values, and they're built to respond to this moment. And here are the key message pillars. Medicaid keeps people healthier and prevents higher costs for everyone. We're using Medicaid to innovate, and we have the results to prove it. Medicaid is under threat, and the cost of cuts will be felt by all of us. Medicaid works, and we should make it stronger, not smaller. We reinvest in care, not profits, and communities are stronger for it. Medicaid is more than policy. It is at the core of community care in this country. So those are the key message pillars, but there is another level, and here is the next level. I won't read through all of them, but this will be part of the materials that you'll be receiving. You see the pillar along with the explanation of the proof points that ladder up to that pillar. Why can we declare this? That paragraph that follows that that sort of headline, it really proves, why we are able to defend Medicaid, why it's important to defend Medicaid, and the perspective that Lutheran Services in America has, that makes it a worthy opponent to the cuts. Now let's get into the resources. We shared the tagline and sort of the overarching theme. We shared the message pillars, and we're also sharing talking points. So you're basically going to have 3 levels of language to share about Medicaid. So you'll have the pillar, you'll have the paragraph underneath that pillar, and on top of that, you'll also have proof points and facts and figures that sort of prove the actual pillar. Along with the member resources, along with those talking points are sort of the core of what we're sending. We've also put together a Q&A and an FAQ. And 1 second, I'm going to take a sip of water. So the FAQ and the Q&A are really set to sort of help you have those difficult conversations. We anticipated some difficult questions that you may get about Medicaid. You'll see here on the screen, it says, isn't Medicaid just for people who don't work? Or does Medicaid really cover children? We really went ahead and thought about some of those more lightning bolt questions that you might get and anticipated the answers. And the answers are rooted in the pillars that you've already seen. So if you think about the pillars as a through line, you're going to see them in all of the member resources. The next member resource is holding statements for media inquiries or social media. So we've anticipated scenarios where you might have to respond, and you'll have responses there for you to use. We've also created op-ed templates for submission to national and local outlets. At the moment, you have 3 versions. You have a version for at-risk or opposed lawmaker districts. You'll have a version for those of you in districts where you have a supportive congressperson. And then we have a 3rd version, which is a version for religious publications and opportunities. So really one rooted in faith. We also put together a meeting guide for advocacy with elected officials. So we really lead you on how to plan a meeting with your elected official, how to drive the agenda, what to think about when you're sitting down with them, and how to use the talking points and key message pillars to convey your message. We also put together a social media post guide that has ideas on what kinds of posts to make, rooted in those pillars. We have hashtag ideas. We have also a box link with pictures you can use. So really, we're sort of taking the guesswork out of how to show up on social media to defend Medicaid. And, this is the second to last one, but I think this is one of the most important for you to make those key message pillars and talking points really hit home, is finding those stories in your communities that show that Medicaid works. So, we'll show you how to identify those stories. We'll show you what makes a strong story. We tell you some things to avoid, like exploitative framing. But really, this is what is going to localize the key messages for you. And then finally, we have just some campaign logos. We'll have a key message one sheet that you can leave behind at meetings with advocacy members or legislators. These are just things that you can use for your own presentations, but really just some logos and artwork that complement all of the member resources. So how do you use these? And I shared a little bit about how to use them in each of the materials, but in meetings with elected officials, in media outreach, on social media, in community conversations, if you're on a panel, if you're having a one-to-one meeting with a partner organization, really anytime you need to explain why Medicaid matters, these materials are going to help. And I think one of our, parting words here is to be brave and be visible. I know sometimes, we talk a lot with communications. People tend to use a lot of jargon, but you do not need to be a communications expert to make an impact. You can share, once you identify your stories, you can share it at church, at a community event, or with a local reporter. You can post things on your organization's social channels or even just on your own. You can pitch an op-ed, even pitch a morning show. There's so many, morning shows all across the country that have, op-ed moments where you can share your point of view, or even an interview, pitch an interview. This is really the moment to take all of these materials and find ways to share them in your community. And again, these are tools, but we want you to use your own voice. Use this, things like the social media guide. That's a great guide, but as long as you're understanding what the pillars are and sort of what we need to convey, you can make it your own and share it with your own voice. And really, this is a chance for us to show what compassionate, community-based care really looks like. So what's next? Now we're going from message to activation. In the coming weeks, we'll be preparing leaders and spokespersons to really deliver the messages clearly and effectively across interviews and public engagements. We're also working on a public sentiment survey. So we're gathering national data to really inform some more storylines about how faith-based organizations are leading the way in healthcare and social services delivery, especially as it relates to people's understanding of Medicaid. We'll be developing an infographic that creates sort of a visual snapshot of those findings. So you'll have more things to share with legislators and more things to share with any advocates that you need to speak with. So with that, I'll turn over to any questions that anybody may have about what I've just shared.
Thank you, Sylvia. And if folks have burning questions for Sylvia, now's a good time. I am going to call on my colleague, Chris Finley, who's just going to, right, a natural question that follows would be like, how do I access all these wonderful materials, right? So I'm going to turn to Chris, but does anyone have questions before we do that? And there is a question from Angie. Angie asked, will there be a template for letters to our representatives? And the answer is yes, right? We have all the materials, right, that Sylvia just talked through, and a lot of that content just gets repurposed, right? So if there's any requests that are outside what you see there, simply let us know and we will make them available. We did a short focus group yesterday with our policy committee just to kind of road test what we had planned. But, if there's something you don't see there that you think is needed, just let us know. And Chris will go through the page and what's there and just communicate with Chris or I, and we'll make sure that we get you whatever you need. So Chris, why don't I let you share where folks can find these resources and what's there?
Yes, thank you, Sue. And thank you, Sylvia, for that great presentation and going through all these resources. So as Sue mentioned, we do have a new webpage available where you can find all these documents. We have the key message pillars, FAQs, per Angie's question there. We do have a meeting guide for advocacy with elected officials. and other important information. And we do also have some visual assets that you'll find in this box folder here. This includes the 3 different versions of the Here We Stand logo that you can find at the bottom, as well as some stock images that are on brand. So this is at lutheranservices.org/Here We Stand. This page is not searchable on our website, so you do need the exact URL to be able to find it, which of course we'll send to you all.
Thank you, Chris. Other questions? Reactions? We love feedback. I see a thumbs up. Thanks, Brooke. Yes, it's our pleasure to put this together. So I'm going to turn to, we're lucky enough to have Margaret Nimmo with us today from Encircle. Margaret was with us recently. Our disability network was on the Hill just a couple of weeks ago. And Margaret was sharing a little bit about what they've been doing to strengthen relationships with their elected officials in Virginia. So I asked her to join us today to talk about action, right? Because we're moving from messaging now to putting that to action, and many of you have already been doing this, right? So Margaret, please, thanks for being with us and thanks for agreeing to share.
Thank you so much. And I'll just say that my reaction to this is wonderful, especially because we've been doing work in the red part of our state in Virginia. And so I think this is going to be really, really helpful to help our network stand apart together with many others who are advocating for Medicaid, but also what makes us different and sort of where our message is coming from. So I find this super helpful, and I know our Encircle team is excited about it. So we have been working on defending Medicaid and explaining what it is that we do to our elected officials, realizing that in Virginia, we have 3 among the important folks in Virginia we want to target are 3 really important ones. 2 of them are in swing districts and were on the letter that I'm sure we're all familiar with at this point of Republicans who push back against Medicaid. So that's Rob Whitman and Jen Kiggins. So we know they are a focus, but first and foremost is Congressman Morgan Griffith, who is a former state delegate who was around in the Virginia legislature for a long time and has been in Congress now for a long time. His district has recently been redrawn slightly and now includes not only a bunch of our schools in Southwest Virginia, but also some of our group homes. So we now have a larger footprint of services in his district. So we started back in February asking for him to come visit us. And we also sort of activated our staff and our family care providers who are like host homes, I think in other states, the sponsored residential service, to really reach out to their legislators. And like many of your states, Virginia is purple. But in certain places is either very blue or very red. And so we have a lot of services in very red parts of the state, which we found to really be an advantage for us in terms of communicating with our congressional legislators, because some of our partner organizations in advocating around Medicaid are really more concentrated in the blue areas, and their relationships are with the blue legislators. And so it really helped us to be able to have those connections. So it took a while, but in April, Congressman Griffith's office reached back out to us that he would like to come visit our group homes in Bedford, which was a new part of his district. So I think that was part of the appeal. But apparently, while he was home for 2 weeks over Easter, he was really making the rounds about Medicaid. He sits on the health subcommittee of the Energy and Commerce Committee. So he is in the room where the decisions are being made, and we really wanted to make sure that we got to him. So we invited him to one of our group homes. We invited families of our residents in that area to come and speak. And we also were encouraged, actually, by his office. We were offered the opportunity to host a provider roundtable. So we had 4 other providers of developmental services, along with who were all part of this network of private providers in Virginia. So one of our leading advocacy organizations in the state around disability services. So we only had an hour. So as you can imagine, that was sort of a challenging thing to make happen. But what we did is invite our families to come to the group home. And we did have some residents there. Some were off doing their own thing, which is their choice, and was a great talking point that some of the residents of the home were actually delivering Meals on Wheels as part of their community engagement, and thus were unavailable to meet with him midday. But we did have 4 families, and so he was able to walk through the home and sort of get a sense of, people with developmental disabilities are living a life in our communities that's just like this home, like you or I could live in this home. It's a great home. It's in a neighborhood. Folks are out doing their thing during the day or home getting their needs met. You're meeting some of our staff. He was very engaged. He asked some questions. And then we went to a very close by meeting room that the county had so that we could fit everybody in. And we really centered the voices of the families and the people served. So we had one of our group home residents who actually came with us and talked about her experience in our group home, like before and after. And then we had 4 families, and they all had slightly different perspectives. And I have to give a huge shout out to Encircle's amazing program staff who has this on the ground relationships with the families. And they're the ones who got the families there. And then really just letting families talk is amazing. They all had slightly different takes, which I think were very relatable in terms of their background circumstances of why this group home and the services that Encircle provides are so important to them. So we then followed up that. So that was the main part of the meeting, and we had other providers there, and we're able to say, these are Encircle families, but if you were with Hope Tree or any of our other partners who were in the room, you would hear similar stories. And they had a short but a little bit of an opportunity to also share their perspective, and then of course exchange information with the congressman and his aide so that those connections were hopefully made and strengthened. And I think some of them have done follow-up visits of their own. So that was a really positive encounter. It went, I think, about as well as it could have because he listened. And he then gave us about a 10-minute spiel at the end about what they were doing, but he was incredibly candid about where they were in the conversation and what was currently being considered and what wasn't. So we were all pretty surprised that we got that level of detail, which of course we then shared and came back to Bill and Sue and said, here's what we learned, here's the state of play, what are our best resources in terms of getting back in touch with them. And then as it happened, the LSA meeting, the Capitol Hill days were the next week. And so Bill helped us get a meeting with his Washington staff. And it was actually the health policy person, Davis Mickles, who was right in the thick of things. And he also gave us the state of play, 5 days later of what it was. And I was able to thank him and talk about and show him a picture of one of our group home residents who was really excited to have met Morgan Griffith, had his business card. His sister sent me a picture because she felt like she'd been part of the advocacy, and I was able to really personalize that visit, which I don't think hurt. And then we were able to really talk through some of the issues. He then followed up with here's what it's looking like, and we were able to provide feedback this week. Did they listen to our feedback? They did not on this go round. But I do think that some of the conversations that we had about the danger of the FMAP and the danger of some of the other huge scale policy cuts, we were able to explain, like, it sounds like it's not related to people who need developmental services, but here's what actually happens for a family when a waiver slot becomes available, and here's how those two things connect. So I think that personal story and experience with the state, since he was at the state General Assembly, helped us make a connection. But by far the most important part of all of this was the families and the stories and the connections that he heard. My closing thing, I'll just say that we found really important to keep in mind, and then informed what we said after that, was he is very aware of the poverty level in his district. Far Southwest Virginia, Appalachia is, not a well-off part of the state or of the country. And he's the one who actually pointed out to us that of the 435 congressional districts, his is about 408 in terms of household income. And so when someone hands you that talking point, instead of having you make it for themselves, that does feel like a point of connection with the students in our schools and their families and the other services we provide. So that has been the on the ground piece that we've done, and we've layered on top of that an op-ed, some letters to the editor, and we've also had some videos that we've shared on social media that I think are available on the LSA resources page about those stories. So people who are not able to visit the group home still get a flavor of what it's like and why Medicaid is so important for people with developmental disabilities. So thanks for the opportunity to share.
Yeah, no, and Margaret, I'm gonna ask a quick follow-up question, right? Because we got to spend some time together on the Hill at the end of April, as you mentioned. And, can you just talk a little bit about like what you did after that meeting and what the correspondence has been like with Representative Griffith's office since then?
Yes, yes. So I think it was, I'm going to make it up, but I think it was a Thursday. We were there. It was a Wednesday or Thursday. And by Friday, we had a thank you email with some follow-up. So part of our conversation, it was very substantive. And part of it, as I mentioned, was explaining like what happens when you're a family that we have a waiting list for waiver slots in Virginia. So what happens when your number comes up? And what does that actually look like for a family? And he actually asked at the end of that, would you please put that in an email to me? So I said, sure. So followed up, within 24 to 48 hours with that information and sort of a recap. And I connected him with our stories so that he had the YouTube video links for that. And then he said he would be in touch with, and we got a response. And then he said he'd be in touch when Energy and Commerce came out with their recommended markup before it went to the full committee, which he did do. And so that came out Sunday night late. And we put our heads together Monday, and then Monday night or Tuesday morning, I believe it was, I sent a message back with, I can tell how much thought went into this, really appreciate that you listened to what we had to say about X, Y, and Z. I'm still concerned about the overall level of cuts and how that will trickle down. And just, again, trying to get back to that point of this sounds like it's unrelated and that you're protecting, because their message is really, we're protecting people with disabilities. These cuts are not going to affect the core people who are supposed to be benefiting from Medicaid. We want to protect that, and we are. And so again, they all voted for it. So it's a long game a little bit here, but trying to make that connection to what we know he already does care about and value, because he came and spent an hour and 12 minutes with us.
Yeah, and just one more follow-up question. What did it take to plan that site visit? Like, could you just share a little bit? Because it might feel a little daunting for people, right? Like,
Yes.
can you just kind of talk about it a little bit, the process?
Sure. So we got to like a week and a half notice, I think, but then had a board meeting in the middle. So it ended up being less than a week to really pull it together. And so the key was, as I mentioned before, our amazing program staff who knew which families to contact that were in the area and would be willing to come and talk. So there was that internal piece of it. We have an amazing communications team, and so we made sure that we had enough people on hand to manage all the moving parts of somebody, a group of people at the group home. Our CEO, Ray Radke, was there, and we, greeted Congressman Griffith when he came. We had a sort of someone designated timekeeper to make sure, like, now you got to get to the conference room. So there were a lot of small details, but it really was not hard. You've had people come visit your facilities before, and it's just that. It's just inviting someone to come and making sure that you're staying on time, because their schedule they do care about. And so when they're in district, they probably have meetings back to back to back. His legislative assistant had made the mistake of telling me that he had a little bit of a gap afterward, and where he had to be, which I knew was right down the road, about 5 minutes away. So we were able to fudge a little bit and get a few extra minutes, but staying on time to make sure that you're getting the content across was important, but very doable. Very doable. It's just, I'm sure you've invited a community foundation or a donor or your board or whatever. It's really just like that. And I think the thing to remember is that you are the expert on what you do, and that's why they're coming. So, he started off by telling us that he lived down the street from the Lutheran Children's Home of the South when he grew up, and we ought to get back to orphanages and all kinds of other extraneous information. And so we could just connect on the point that he knew who we used to be in our history, and then move on to the topic of the day. So whenever they start throwing jargon or other topics that maybe you disagree with or whatever it may be, just you were the expert on these services, and that's what he came to see.
That's wonderful, Margaret. And, you know, I was struck because I went with you, right, as part of your disability network visits that, um, you know, these are, you know, Margaret's saying, right, in the end, they didn't vote the right way, right? But you could tell in that discussion, you know, they were grappling, really looking for as many insights as could be provided to prevent these, you know, to prevent these are hard choices because as Margaret Wright described, the district that he's in, the demographics of that district, these are hard choices. So, you know, we don't really feel this, right? Because we have a giant package here with all these billions of dollars of Medicaid cuts. But I think, you know, there is recognition in that conversation that, but on Margaret's part, you know, acknowledging this tough situation that they're in. And I think really just trying to be as clear as possible about the impact of the cuts. And, you know, Margaret, you and your team did that so well in that meeting. So I think it's an important example because, you know, we talk about, you know, and make these recommendations, but it can really make a difference. You know, I think in circles now on their list, right? When these questions come up, you know, they're going to be consulted, and that's what we're trying to do is build durable relationships, especially with these newer and certainly more moderate Republicans. That, as I said, that'll continue to be the focus. And if you're not sure what committees your members are on, or if you have questions, we're here to be your resource. There are no bad questions. This is still a pretty new Congress, and they're trying to bite off a lot. And I think Sylvia's messaging build up spoke to that, right? That the awareness that's needed in the public isn't at the same level as the action on the Hill. And so hopefully you've got some better resources and materials. Yes, and Bill, we can go back to the timeline slide. If someone could pull up the slides I went to, just to reinforce again the timeline that we're looking at here. You know, the House is really trying to pass a bill, a package, right? Their budget reconciliation package by Memorial Day. So we do not have a lot of time. We don't have a lot of time. So you can see, right, tomorrow is the appropriations budget committee hearing on all things health and human services. Next week, GOP leaders present the bill to the House Rules Committee, which is a key step because this is budget reconciliation. And there's a lot of process associated with this. So that's a significant step with the goal of the House passing their package by Memorial Day. What will happen then is the action will move to the Senate. They'll have a similar process that the House is going through, and then this all still has to be reconciled, right? So we want these cuts to be as minimal. We really don't want any cuts, right? But we want them to be as minimal as possible in the House because then, right, I said at the top, Senator Thune signaled last week, who's the majority leader in the Senate, who's got Speaker Johnson, same role in the House, right, trying to get this through the Senate. They signaled $600 billion in cuts in the Senate. So they're going to have a package in the Senate and then reconcile it with the House. So this is the time to continue this outreach. You know, there's still time to organize site visits and use these materials and so forth. So let's go, if somebody would just go to second to last slide, I'm going to just review again where you can find all these resources and what we have planned, right? So Chris talked about the webpage. We have a link. These slides will be sent out to everyone after the webinar and also sent out to all who registered. We have our next Capitol conversation on June 19th at 1 p.m. Eastern. Sign up for our advocacy alerts. One went out last week, one went out earlier this week with all the analysis of what was in the House Energy and Commerce Committee package. So, you know, we're trying to keep everybody as up to date as possible, so you have the latest information. If you're not already subscribing, Kaiser Health News through the Kaiser Family Foundation has done an incredible amount of work on very specific issues like work requirements. There's great resources there. It's free. And they'll send updates to your inbox every morning. You may not want that, but you can also opt for them weekly. It's just a great resource. And then want to make sure people know, right, this is Defend and Strengthen Medicaid. So our new issue brief is out, titled Innovating Care for Children and Families Through Community Partnerships that Leverage Medicaid Managed Care. And there's 5 brief examples of the work our members are doing toward effectiveness and efficiency that are improving outcomes for kids and families. So please use that as it's helpful to your work and efforts. And we'll have additional case studies and a next issue brief out soon. So if you have any questions about that, let us know. And I'm just going to open it up. Any closing comments that folks want to make or questions? We still have Silvia with us. And if there are questions or comments, please, I'm going to open the floor.
I have a question just based on the conversation. I think one of the things that was a helpful starting point in our conversation with Griffith and his staff was making the assumption that they care about the people we're there to talk about. Whether I actually believe he does, although I disagree with him on many things, but there, you could find yourself talking to someone who you're not really sure if they do or not. How do you see this messaging helping in that situation?
Yeah, and we actually thought about that as we were building the key messages because we really wanted to have talking points that would resonate with with legislators across the political spectrum. And so one of the pillars is about cost and how the costs don't go away if you cut Medicaid. They just go to someone else, right? They either impact the states or it means hospitals close. Ultimately, it's bringing the truth forward that the costs aren't going to go away, they're going to shift. And so it's really speaking to the financial burden, which I think, for perhaps a legislator that does not, sort of the people-centered message does not resonate, the financial burden one will, because it impacts their districts financially.
Yeah, no, thanks. And I just want to add our research partner at George Washington University did a wonderful, quick lit review that is on our advocacy resources page. And you can find it there. And it really talks about how Medicaid saves money, right? To Sylvia's point, we really tried to pull through on that, and there's some great examples there. And if folks have trouble accessing that, please reach out. We'll make sure you have it. And as Sylvia said, when you really dig into the content, I know Sylvia went through the pillars and the top lines today, but when you look in the content, her team has done we think, a wonderful job kind of pulling through on how to succinctly describe those trade-offs, right? So great question, Margaret, and hopefully you see that reflected in the materials.
Yeah, and I would also add, not to belabor the point, but we also added, in the messaging that's deeper, we added things about community impact. So even if you're not on Medicaid, if someone in your neighborhood or someone in your community is off Medicaid, that will ultimately impact you. Not from an emotional standpoint of, oh, I care about my community. It's more about, will your community be safer if people are off, the services that Medicaid provides?
Other questions? Okay, Sylvia, I'm going to give you the last word. Any parting comments or just things that you want to wrap up with?
I think if we love feedback. So as if you're looking at the materials and there's something that you need or you feel is, unique to your area, please reach out. We can repurpose these materials in so many ways and really quickly. Our objective is to really help you just get the message out and share all of this, share the information. So if there's something that you need, please don't hesitate to reach out. We can certainly help you.
Thanks, everyone. And the recording and materials will be available after the call. Thank you. Have a wonderful day. Keep up the great work.
Thanks.